Hello students, my name is Mrs. Terry and I'm an instructor here at the McLennan Community College Associate Degree Nursing Program. We're going to demonstrate today just a very basic physical assessment. Some people call it the morning assessment. In doing so, we're going to show and utilize a number of assessment tools. These, at least the physical assessment bedside tool, you will be able to use. So for the purpose of this demonstration, if you want to go ahead and get this tool out so you can sort of check along with me. Another tool we're using that you will not be able to use during your check-off, but just for demonstrations today, has to do with auscultating the breath sounds and then also locating the pedal pulses, okay? So these two forms will be on my desk or on my bedside table as we move through the process. Okay. Good morning. How are you today?
I'm good.
Good. My name is Mary Terry, and I'm going to be your student nurse today. Can you tell me your name and your date of birth?
Michaela Ivera, 9/12/98.
Okay. I don't plan to use any gloves for this examination, but if I do decide to, are you allergic to latex?
No, ma'am.
Okay. So we've already come into the room a few minutes prior, and we've done your vital signs for you, and so now we're moving straight on to the assessment, okay? So can you tell me if you know where you are?
At the MCC Hospital,
Okay, and do you know what day it is?
and it is January 31st of 2018.
Okay, very good. So I'm going to just continue to follow down this list. I will ask you, we asked before when we asked about pain, but the other thing is, why are you here today?
For a surgery on my right hip.
Okay, that's right. Okay, so can you tell me if you're having pain right now anywhere in your body?
I'm just in that right hip.
That right hip, okay. So between 0 and 10, 0 being nothing, 1 being minimal, 10 being the worst pain you've ever imagined, can you tell me about where you are on that?
It's about a 5.
Okay, and are you okay with it being a number 5?
I'd like for it to be gone, but
Okay.
it's tolerable.
Okay, so can you describe for me what the pain looks like? Is it constant?
Yes.
When you move around, does it improve any at all?
No.
So does it worsen?
It worsens.
Okay. Is it a lightning type of pain? Does it strike? Or is it pretty constant?
It's pretty constant, about a throbbing.
Okay. So what you're describing sounds like it's muscular. It sounds like it's smooth muscle pain, okay? So let's move on further in and we'll try to get you something to move it down, okay? So students, again, as you are doing this assessment, you are able to use this. You are able to jot notes down, which you should be doing. Okay, so her speech is clear and appropriate. And now I want to ask her about her eyes. Have you had any problems with your vision at all? Do you wear corrective lenses, maybe contact
No, ma'am.
glasses? You don't? Have you had any kind of itching or unwanted tearing or redness in your eyes at all?
No.
Okay, so I'm going to take a look real quick at the sclera. Okay, so it looks fine to me. So now I want to sort of check your vision a little bit and your accommodation of your eyes. So if you would, find a place on the wall straight ahead and look at that. And then I want you to look at this pen. Then look at the wall, and then look at the pen. Okay, so now I want you to follow the pen with your eyes. So, good, and out. Here we go. Very good. Now I want to check your reaction to light. So if you will just continue to look straight ahead, and sort of come around the back of you, and I'm going to see what your pupils do. They constrict when the light comes. So keep looking, and this one does it well. So it sounds good. Let me ask you about your ears. Have you had any kind of drainage at all in your ears?
No.
Okay, I just want to look and see if you have any kind of redness in there. I don't see any. Let me kind of look to the other. So is your hearing okay?
Yes.
So you don't need hearing aids or anything like
No,
that?
ma'am.
Okay. So any kind of congestion in your nose? Are you breathing okay?
Yes, ma'am.
Okay, so can you breathe out that that side. Inhale, breathe out that side. Very good. Do you mind if I look up inside? No sores or anything? You're doing good. Okay, so I would like to check your mouth. Do you have any dentures or implants that we need to know about?
No.
Any kind of problems with your dentition at all? No missing teeth? Okay, so no missing teeth. It looks fine. The mucosa looks healthy and pink. Okay, very good. Okay, so we're going to continue to follow down the line here. So now we're going to go to the cardiovascular system. You will find that on your bedside tool as we move along. So we need to assess the apical pulse. So for purposes of this assessment, you're going to assess the pulse, the apical pulse. You need to have skin on skin with your bell, a larger bell. So if I may. Okay. So for demonstration, we'll shorten this a little bit, but you're going to listen for 30 seconds and then double that. You're going to note whether it's a regular rate and rhythm, if it's a little irregular, if you may or may not hear swishing sounds, but we'll talk about that at another time. If you have trouble listening to it here, there is another place that you can listen that sometimes you can hear a little bit better, and we'll discuss that later in lecture. But may I? You go ahead and pull your breast up for me. So you would listen right about here, okay? That's the PMI. All right. And you would listen for that if you were unable to hear here. And again, it would be skin to skin. So then you're going to be actually recording what you're hearing as you go along. You continue to record. So now I need to see about her capillary refill. So to do that, I'm just going to look at one finger, not every one, but on each hand, and I'm going to press a little bit, and I'm going to see when the white actually returns pinkish. And it needs to do that very quickly. So I'm going to do it on the other side too. Okay, good capillary refill. All right. So I'm going to try my best to stay with this form and just continue so make it easier for you. So at this point, I'm going to go ahead and check her pulses. Now, we've given you a handout, and I've shown you earlier. It's part of the auscultating the breath sounds and assessing the pedal pulses. And so you will not be able to take this into checkoff, but you certainly do need to practice with it and learn where those are. Learn where the posterior tibial pulse is and the dorsalis pedis. So, may I? Okay. So we come down here, okay? And the camera's going to move in just a little bit, and also maybe we'll put this so you can see it a little bit. But what I'm doing is I'm checking first for the posterior tibial, and that's going to be about right here. And if you'll look at your diagram, you can see that, and I feel a really, really good pulse here. And I'm going to do the same thing over here. May have to search a second, but I do feel a good pulse. So the next one is going to be the dorsalis pedis, and it's going to be right about here. And you just have to, not a heavy touch, but a light touch to feel it. It's got a good pulse right here. And a very good one right there. Okay? All right, now continue to look at this hand tool because now I want you to follow along with me as I auscultate the breath sounds, okay? All right, so there are going to be 4 sites for me to listen to her breath sounds anteriorly and 6 sites posteriorly. And we will again discuss that in class, but please follow along with the diagram that we've provided. Okay. So I want you to breathe normally, okay? And when I ask you to take a deep breath, just do so. Okay. So take a deep breath and out. Again. Okay. Pardon me. Again. And again. Very good. Remember what you're listening for. You're listening to the breath sounds. We're hoping that they will be clear. We will discuss a number of other things they could be at a later time. If you could sit up just a little bit, and we're going to bring the camera in so you'll get a better look at what we're doing. Remember, you want to at least hear one good breath in and breath out. Okay, inhale and exhale when you're examining. So we're going to start here, and we kind of call it the S. So take a deep breath. And then I'm going to listen down here. And I'm going to reach around. Okay, very good. So let me urge you, you can lie back. As you are doing your examination, go ahead and talk to your patient. Let them know what you're about to do. They're a little anxious too. And communicate with them as possible. Now, your lungs sound really good, and you're not on any oxygen. You're just on what we call room air, and you feel pretty good. Is that right? Okay, so if we follow along with our assessment tool, the next assessment is actually going to be the gastrointestinal. So, I'm going to lay you down just a little bit, recline you so that I can actually look at your abdomen, okay? Okay, so I'm going to raise the shirt, and what I want to do first, you always look first before you auscultate. So we're looking for symmetry, we're looking for the skin color, breaks, any of that kind of thing. Have you had any kind of abdominal problems?
No.
Okay, so I'm looking and everything looks fine. Now I need to listen to 4 quadrants of the bowel, the intestinal tract. And what I'm listening for is just to see if they're active, hyperactive, diminished, and maybe even not there at all, absent. So just relax. They all sound active. Can you tell me when you had your last bowel movement?
Yesterday?
Yesterday? Okay, and how did it look? Was it well formed?
Yes.
Was it brown, yellow?
Brown.
Was it any strain to have that bowel movement?
No.
And do you have a pretty regular bowel movement?
Yes.
Okay, very good. So then you're going to continue to make notations on this as you go along, okay? When you did have the bowel movement, did you have any pain with it at all?
No.
No, you're good. Okay, so now let's talk about the urinary. When is the last time that you voided or urinated?
An hour ago?
Okay, and what color was the urine? Was it light yellow, amber?
About a light yellow.
Okay, was it clear or was it cloudy?
It was clear.
It was clear. Did you see any kind of sediment in it at all? Any kind of little flecks or particles?
No.
Okay. And did you have any trouble voiding? Did you have any pain when you were trying to do that?
No.
No. Do you ever have any types of incontinence, for instance, if you cough, do you sometimes void a little bit?
No.
Okay, so sometimes that may or may not be considered a problem, okay. But you don't ever have problems with dribbling the urine?
No.
Okay, so then the student would make a notation of that. Now we're at the musculoskeletal, and I'm going to move you back up again. Okay. Just for your comfort, actually, we could have done this lying down, but we'll let the camera to see as much as possible. Okay, so I'm going to ask you to do some simple range of motion. So I want you to take your arms straight out, and I want you to pull them up to your chest, pull them back down, pull them back up, go like this, and down, and you're done, okay? Did you have any discomfort or pain doing that? It
No.
moves easily. Okay. Let me go ahead and check your grip strength. So I am going to let you grab on to my 2 fingers, grab onto this, and squeeze. Okay, so the purpose of crossing it, okay, thank you, is that when I come back, I automatically know that this is the right grip and it was strong. This is the left grip and it was strong. And I can actually document that. So now we need to look at the pedal pulse. Well, did we look at the pedal pulses?
Yeah.
I think we did. Okay, so let's look at the flexion because we're still trying to go by this list. So what I need you to do is press against this hand, okay? Now pull on your own, pull it up. Any pain or discomfort? If you will press, very good. Pull it up. Any pain or discomfort? No. Okay, so then the documentation would go there. Now, you're having trouble with your hip, so my question to you is, are you using any kind of assistive device, like maybe a walker, a cane?
I'm using a cane.
You've been using a cane?
Yes.
Okay, so do you have that with you? Okay, so because of the nature of why you're here, it's great you have a cane, but I would ask you to always give us a call at the nurse's station so that we can be sure that you're safe with that, okay?
Yes, ma'am.
Okay, so we'll note that you have a cane on here. And then we're going to look at your skin overall. And I've seen your legs. If you had pajamas, we could do a little better job of that. But can you tell me if you have any kind of rashes, breaks in the skin, scratches, anything like that at all?
No.
Okay, so I'm going to kind of look over your skin. So you said no, your skin looks dry and healthy appearing and pink. I've seen your tummy, so I'm going to look back here and look at your back, and it all looks fine. Okay, so no complaints with that, no kind of itching or outbreaks or anything. Okay, and then the temperature feels warm to the touch, and there's not really any moisture that I can feel, okay? All right, so I need to check your turgor. When I check your turgor, I'm just trying to figure out what maybe your hydration status would be. And so I'm going to go over to a side on the chest, and I'm going to do just a tiny little bit of a pinch and let go. And if I had been able to draw up a lot of skin there, okay, it's possible that you could have been a little dehydrated, and I would have cautioned you about that. But you seem very hydrated, okay? So that's the turgor. Now, before I leave, I'm going to ask you about what we call the 4 Ps. That is, do you need to go to the potty?
No.
Okay. Do you need to, well, you don't need to go to the potty. Do you have your possessions with you? Do you have your cell phone? Do you have
Yes.
that nearby? Okay, and do we have the call light nearby as well? Okay. And your position, are you okay sitting this way, or would you rather be lying down? Comfortable? You're pretty comfortable? Okay, so you've got your call light with you. And do you have any questions with me, for me at all?
No.
Let's make sure your bed is in the lowest position. Okay. All right, let's get you back covered up. You comfortable?
Yes.
Let us know again if you need to get up, because we certainly want you to stay safe.